Today, our focus is on the transformative power of artificial intelligence in healthcare. Let's first know why understanding this transformation is crucial. Over the years, as the innovation has developed numerous healthcare software solutions, ranging from custom built applications to tackling complex challenges. Through this journey, we have observed a significant shift in the industry's mindset towards AI driven solutions. Business owners are more focused on automation, efficiency, and optimization through AI technologies, aiming to enhance productivity while reducing maintenance cost. We have closely monitored how clients are going towards AI-driven solutions, reflecting a growing demand for innovation in healthcare. Beyond our company, industries like Google Health, IBM, and some other companies were early adopters of AI solution. They have developed remarkable AI tools to support various aspects of the healthcare industry. The future of healthcare lies in AI, and it's important for stakeholders and medical enthusiasts to embrace and integrate this advancement into their practices. Here are the 5 points we have added to the agenda. At first, we'll discuss the AI revolution. Here, we'll get to know what some of the big companies are doing in this sector, what they have built so far. In the next point, we'll try to compile all the findings from the first topic and prepare a list of the AI adoption or in what area of healthcare software is getting targeted, what problem they are solving. Next point, we'll try to share some potential ideas or features where some of the development can be done in the future. After that, we'll be discussing SJ innovation contribution towards this industry. Next, we'll be discussing some of the ethical considerations and challenges while building and maintaining these tools. Moving to the moving to the next slide. In this section, we'll get to know what are the things the tech giant is building and using with the help of AI in the healthcare industry. So here you can see a list of various companies. IBM Watson and Google Health build healthcare software using AI to help doctors. It reads medical images more accurately and suggests personalized treatment plans for patients, which makes healthcare decisions smarter and more efficient. Path AI uses AI to help pathologists to analyze tissue samples more quickly and accurately, especially in diagnosing cancer. Campus uses AI to analyze genetic data and clinical information from patients with cancer. It helps doctors find the most effective treatments by analyzing patient unique genetic makeup. Zebra Medical Vision and ADOC, both companies use AI to help radiologists to detect disease in medical images and find abnormalities faster and more accurately. Butterfly Networks and Prognos, their AI tools help healthcare providers to interpret ultrasound images, making it easier to diagnose and monitor a wide range of medical conditions at the point of care. Siemens and Sophia Genetics uses AI to improve medical imaging technology, making scans clearer and more detailed. It also helps to analyze genetic data and identify genetic risk factor for disease. Nuance AI-powered speech recognition technology that helps doctors to dictate notes and enter data into electronic health records or EMR more efficiently. It saves time and reduces errors. Epic System, Cerner, and Health Catalyst uses AI to make electronic health records or EHRs smarter, helping doctors and nurses access and understand patient information more easily, leading to better decision making and care coordination. Alive Core's AI-powered heart monitoring technology helps patient and doctor detect irregular heartbeats and other heart conditions early, enabling proactive management of health. DeepMind's AI is another big company that use AI to analyze healthcare data and improve patient care, such as predicting when patients might collapse and providing doctors with personalized treatment recommendation. QBeam uses AI to analyze medical imaging data and extract biomarkers that can help doctors diagnose and monitor disease more accurately, leading to better patient outcomes. Tempus Lab uses AI to analyze cancer data and help doctors match patients with the most effective treatments, improving outcomes and quality of life for cancer patients. Suki's AI powered voice assistant helps doctors with administrative tasks like taking notes and filling out forms, which is freeing up time for doctors to focus on patient care. A lot of other companies out there that are also doing great work and building amazing AI products. Here we just reviewed a few of them. We'll be moving to the next slide.
Mohan, we have a question from the audience.
Yeah, sure.
I mean, can you tell us about the drawbacks of the of using this AI tools? Since you have talked about the benefits, maybe you can talk. Maybe you can also shed light on the disadvantages of these tools. Maybe a small comparison.
Yeah, sure. Yeah, I just shared a few advantages. So every technology comes up with many advantages as well as some of the drawbacks. Using AI tools also have some of the drawbacks. The most important one is data privacy concern. AI algorithms require access to sensitive patient data. It raised the concern about privacy breaches and potential misuse of information. Another disadvantage is algorithm could be biased because system can be biased based on the training. Healthcare regulations always keep changes where AI tools need regular maintenance. Integrating AI tools itself is not an easy task. It requires time and efforts. And the final one, I would say lack of trust, because people may not always trust the decision of AI, because sometimes human beings does not know the decision-making process of AI. So I think these are the drawbacks, major drawbacks I would say so far we have noticed. Yeah, I hope this answer your question.
Yes, it does. Thank you.
Okay, so let's move on to the next slide. So in this slide, we will try to compile uh, some of the information from the previous slides where we have discussed a lot of uh, tools that have been built and using by the tech giants. So we'll see like what are the areas they are targeting and what are the problems they have solved so far. So first, I have added medical imaging analysis. Okay. So companies are refining AI algorithms to help doctors analyze medical images more precisely, aiding in early disease detection and improving treatment planning for patients. Next, clinical decision support. Companies are integrating AI into healthcare software to offer real-time assistance to clinicians. It utilizes patient data to suggest personalized treatment option and enhance decision making. Then virtual assistant and chatbots. Companies are leveraging AI to create virtual assistant and chatbots that can interact with patients and provide them medical information, appointment reminder, and support, which is improving patient engagement and satisfaction. Researchers are using AI to analyze vast datasets and predict the efficiency and safety of potential drugs. It is minimizing the drug discovery process and bringing new treatment to market more efficiently. Then people are using AI to automating the task. Companies putting their efforts into automating routine administrative tasks, which is freeing up healthcare professionals' time. EHR enlargement. Healthcare providers are integrating AI into electronic health record to streamline data extraction, entry, and analysis. It is making EMR more user-friendly. Then improving accuracy and efficiency. Businesses are taking the help of AI to improve the accuracy and efficiency of healthcare process, such as diagnosis and treatment planning. Personalizing care. AI-powered tools are being developed to analyze patient data and preferences. It allows healthcare providers to personalize treatment plans according to each patient's unique need and characteristics. Remote patient monitoring. Companies are developing AI-driven remote monitoring solutions to track patients' health metrics and vital signs outside of traditional healthcare process. Then there is telemedicine and remote consultation, another popular category. With AI integration, telemedicine platforms are enhancing remote consultation by providing diagnostic support, facilitating virtual examination, and enabling secure communication between patient and healthcare providers. Then predictive analytics for disease prevention. Using AI algorithms, healthcare organizations are analyzing patient data to predict disease risk and identify preventing measures. Finally, there is fraud detection and security. Experts are leveraging AI algorithm to analyze healthcare data and identify suspicious activities. It enhances security measures and prevent fraud transaction within healthcare system. So I think these are the major categories that have been uh, developed using by the industries. Okay. So we'll move to the next slide.
Mohan, we have a question from the audience.
Yeah, sure.
So just let me reframe this question properly. So one of our audience member would like to know what are the top categories where business owners should focus. So just to elaborate that question, since we have since we have a lot of clinic owners and hospitals are interested to implement AI in their practice. So can you share the top three or top five areas where they can implement the AI for starters?
Yeah, sure. So I think it's difficult to pick one or two. We have seen that the big companies are using it in many different ways. But there are some of the things are common. And if we compile those information, I can tell you for the startup or the mid-level companies who wants to leverage AI on their healthcare software, I would first go with the image analysis. So this is going to be a big market where uh, the healthcare software can use the image. They can take up patient images and analyze it for early detection of the disease, for better medication. Okay, so and to keep a good track record of the patients. So this would be the first area where they can target. Okay. The next one, I would say telemedicine. This is becoming more and more popular nowadays. So through this, the providers don't need to go to the patient, or patient doesn't need to come to the clinic, okay, physically. So they can target this telemedicine. I would say this could be the second priority. The third one, I would say the EMR enhancement. There are a lot of built-in EMR, which is helping the healthcare industry, healthcare like the hospitals or the clinics. They can use those, and I believe most of the healthcare institution already have this, so they can integrate AI on this healthcare software. They can maybe automate their regular task. Um, and some other things that I have discussed in the earlier slides. So I would say enhancement of the EMR software will take the third priorities. And there are other two things. If someone wants to go even broader. I would say they could take up the predictive analytics, where they can use the history of the patient, and based on that, they can predict what could be the disease condition in the next 6 months of the patient. Okay. So that will be another area. Okay, so predicting analytics. And the fifth one, maybe this is gonna be for the little bit bigger companies, where people are working for invention of new medicine. Okay, they're they are training up the AI, or there are a lot of existing models where you can give the symptom and the existing medicines, the elements of the medicine, and by combining all the information, AI is actually helping to invent new medicine. Actually, the researchers and the medical professionals are already using these things. So I think these are the five areas that the startup companies can focus on. Okay. Yeah, I hope this answer your question.
So first thing is the booking management. So we have built a booking management which can be integrated to different kind of software via Google Calendar to represent all the appointments in one single platform. And the drawback of that is that if you are integrating a lot of software into one and getting all the appointments in one place, it is hard to manage them all. So to do so, someone always has to stay alert and check the free slot and already taken slot. So to optimize that, we have started utilizing AI on that part. AI can better solve that problem by managing the free time and already taken time. Then coming to the part where we have the clinical decision support, meaning that we already have built a system where we have the record of the patient, and those record can be used as a reference for any kind of decision making support via AI. So AI can help you with all the decision making. If you don't like that decision, you can always put in your experience into that, because AI is part of the portion. AI uses the part of the portion that is already being added as a record, then analyze that, and based on that, it provides you suggestion. It is not going to be 100% accurate. There always has to be a human touch to that. Then we have created a numerous automated process, starting from sending reminder. Then we send out different kind of uh, uh, instruction to the users or the patient, what you need to do before the treatment, what you have to follow after the treatment. So these kind of automation we can better manage using AI. AI will help us to identify which portion is more needed based on the user feedback. So based on that, we are training our model to better send the notification or the alert system or the instruction to the patient. Then we have created chatbot. So chatbot has multiple uses in terms of healthcare. It can be used as a reference or as assistant for the doctors, where doctor can ask anything for a reference to the chatbot, or it can be used from the patient side, where they can have some assistant if the doctor is not available. With the knowledge of the doctor, it can provide them the solution what they are looking for. So this is what we have achieved through AI on the industry. Yeah, over to the next slide. So now I'm going to talk about the possibilities that can be achieved using AI. So first thing is AI powered nutrition deficiency detection. So a lot of people are nowadays suffering with nutrition deficiency, which can be easily tracked via a smartwatch. Nowadays, we have very advanced smartwatch which tracks a lot of data while wearing them up. All we need to do is that transfer that data to any AI and then put in our diet chart on the AI as well. If we are feeling any kind of symptom, that also can be updated, and based on all this information, AI can tell us if we are lacking into some kind of supplement or some kind of vitamin that we need to take, or we need to update our protein structure or throughout the day. Anything that is needed to improve our diet, that can be suggested by AI. Then we have smart inhaler or insulin. In US only, there is a whole lot of case that we have observed that people are dying mostly from diabetes, mostly type 1, and a lot of people are getting asthma nowadays due to the air pollution. So these are the two things are very needed for the patient to survive. So what AI can do is that based on their uses, it can give them alert if they are missing out on their next dose, because these two things are very crucial for the patient. If they miss any dose, it can be life taking for them. So to better optimize their time or their life, to save them, we can use AI to have the users monitoring and then give them alert based on that. Then we can use AI in medical tourism optimization or primary healthcare. If you are moving from one region to another, you can always ask AI to what kind of diseases are there, what different kind of diseases are there in the region, what kind of precautionary measures that you have to take while visiting that region, or coming from that region. You have to take some kind of vaccine so that you don't spread out that same disease to your loved ones. Also, while traveling, you might not have the access to the healthcare every now and then. So what AI can do is that if you are suffering from any kind of situation you are not aware of, you can always ask AI to help you out with the primary healthcare. And if you provide the regional address to that, they can also provide you the information that are out there online to get to the closest healthcare division. Then prioritize healthcare coach. A lot of people are trying to get fit or trying to be fit, who can take the help of AI and create their own assistant. And with that assistant, they can define what kind of a life they want to live, what kind of diet they want to do, what kind of a weight they want to have. So based on all this information, AI can help them to reach to their potential or reach to their goal to stay fit and healthy. Then voice activated EHR navigation. A lot of elderly people can't actually navigate through a lot of record that are available for them or their record, because a lot of time elderly people get confused while using a new system or updated website. So what AI can do with their voice, it can navigate throughout their report, and whatever they are looking for, it can get it from the report and present it to the user. They don't have to go through the hectic journey of exploring the website or the application. Then surgery simulation. It is getting quite popular nowadays. It is pretty much similar to a airplane simulator where pilots get to uh, try their first flight before even getting to an actual cockpit. So what surgery simulator can do is that before a critical surgery, it can replicate the same lookalike uh, situation from the imaging of the patient and create a dummy hologram upon which the doctor can practice their surgery. And based on doctor's hand movement and gesture, it will also simulate what kind of a reaction the patient will have. It will help the patient to stay alive and have the doctor to also be able to complete his surgery without even harming the patient. Yeah, so that is it for the future of the healthcare. Moving to the next slide.
Thank you, Onim. Onim, can you share a few practical examples and or maybe use cases which can be implemented by small clinics that
Yeah,
could be helpful for our audience?
Yeah, sure. Sure. So I'll share one use case that have been reported. It is a US based use case. So one of the patient early this year was having a symptom of chronic pain. So he went to a doctor where he just explained all of his situation, and doctor didn't actually understood what exactly the problem was, because there was no outer symptom. Or then he ordered a bunch of tests. Getting those all reports in hand, he couldn't actually make up what was the actual problem was. So the patient was having a lot of pain, so he went to some other doctor to have second or third opinion. After visiting a lot of clinics and a lot of doctors, he didn't got his solution. So he ended up uploading everything in AI, all his reports from different doctors, all their analysis on the AI, and he uploaded all his routine throughout an entire month. And after that, after putting all this information, the AI was actually able to detect a rare disease that he was having. Then, with the help of the AI analysis, he went to a doctor. Then they could actually relate to the symptom with that disease that the patient was having. Because it was so rare, the doctor couldn't find it on the first go. But with the help of AI, they were able to find it eventually. So he got his solution. So if clinics implement this AI to analyze the report and get the symptom from the patient, they can save their time and work it as an assistant on their behalf uh, to better analyze the disease. So I think that answer your question, Vishu.
Yes, it does, Swami. Thank you.
Okay, so as Mohan earlier said that every new technology comes with drawbacks. Now we'll talk about the ethical concern and the challenges that we have on implementing AI into healthcare. So first thing is data privacy and security, then algorithm biasness, then we have transparency and explainability, then accountability and liability, human oversight and control, then impact of healthcare overflow, um, compliance and regulation, and new security vulnerability. So I'll explain all of this in giving you one example. We all are aware about uh, the pacemaker that gets implanted into a patient's heart whose heart is not capable enough to pump blood through the body. So we place a pacemaker on that. The pacemaker also tracks how many pulse that generates in a minute or so, and a lot of data are accumulated to that pacemaker. So all this data can be analyzed remotely, and that data can be passed to a AI. That AI can decide how many pulse should, this pacemaker should be making to keep the patient more healthy and to keep the patient more active based on their activity and all the data combined. But here comes the challenging part. If the data get breached at any point of time, the patient life will be in risk. So the data privacy is very much critical over here. Then algorithm bias. If the algorithm is not trained enough to identify what kind of a response it should generate from patient to patient, then the patient might end up having more pulse than the expectation, because if the algorithm is not trained enough to better identify the pulse rate for the minors, for the middle-aged person and the elderly, because all of them will have different pulse rate for them based on their age, based on their activity that they perform in a regular day. So if the algorithm is not trained well to identify that age gap and their activity, then it will end up killing that patient. Then all this data has to be transparent enough for a doctor to check if the AI is working towards keeping the patient healthy or not. It is also the accountability of the person who has created that AI to take the ownership of keeping the AI in a way that it never goes wrong or never crashes, because a human life is on the line. Then we have uh, a lot of different other scenario of getting the AI hack or this kind of thing, to the extent of AI uses and challenges. So yeah, over to the next slide, Mohan.
Anil, can you talk about some, since we are talking about data privacy and data security, so a lot of users are using this, Gemini and OpenAI and all that. So using this OpenAI and Gemini, is it HIPAA compliant since we are dealing with PHI? Can you shed light on that?
Yes, we can. So I'll explain it in one of the example that we have. I'll give you a demo of the product that we have built with AI. So the first thing is that we know in healthcare industry, HIPAA compliancy is a very major thing. We can't compromise the patient data in any cost. So the patient data is the highest priority for any kind of application in the healthcare industry. So if we are using the public um, uses AI that is out there in the market, let's take ChatGPT for example, Gemini or any other AI. If we are using it and providing any patient data, that is not secure, because ChatGPT, Gemini, none of them have defined that they are not going to reuse those data. Also, they are going to train, they have defined that they are going to train their AI model using those data. But for us, we are using the paid version of the software, or for the Gemini and the ChatGPT as well. So in the paid version, they have specified that they are not going to use the information that will be passed to them uh, for any kind of training purposes. Neither they are going to store it. And also, we are using the API version of it, meaning that we are not writing anything in the prompt so that they can save it for their later on usage. We are using the API to get our response, meaning that we are sending the request encrypted on the API, and we are getting the response and displaying it on the user panel, meaning that the data is quite secure from the HIPAA compliancy association if we are using the APIs. So I'll give a demo to what product we have made, but hopefully after the demo, it will satisfy the answer. So hopefully my screen is visible to you. So I'll quickly give you example of what is the difference between two things, Gemini and the product that we have made. The name of the product is Collaborative AI. So here I have just asked a simple question, what to do if someone is having a heart attack. So it have generated the report based on my query, and it has segmented down into few sections based on the situation that I'm currently in, because I haven't provided enough information to analyze it, what kind of a situation that I'm in, whether it is in the post stage or it is in the pre stage, or currently someone is having heart attack in front of me. And if we compare the same thing, I have written the same thing in Gemini API, that have given me a bunch of information which is quite relatable, but it have given me references. Instead of giving me a proper solution, it have given me references on what to do exactly. So reading this will not properly help me if I'm in a rush, whereas our product will give you more accurate data and more organized data into this situation. And using this product, we have the flexibility to create as many assistants as we want, meaning that if you are a enterprise user, you can definitely buy the ChatGPT version of the 4.0. But what we are doing is that if you buy this product instead of ChatGPT, you will have the access to create as many accounts as you please and create assistant for your liking. Then that assistant can be either made public for all the users into your account, or you can restrict the uh, assistant towards you. And the assistant that you are making, you can upload a bunch of information. You can train it to get the information from the open source data, or you can ask the assistant to give you only that particular file related information. What I mean by that, I'll just explain it why creating an assistant. So first thing, you provide a name, then you select avatar to that is not needed. You provide the instruction, meaning that what exactly you are looking for from this assistant. So what kind of assistant do you want? You can define that. What this assistant should do, you can define that. If it should only follow the file that you are uploading, meaning that you can upload any book, any medical related book, any surgery related book, or any disease related book that can be uploaded over here. You can ask this assistant to only provide you solution based on the book that you have uploaded, or if you want this assistant to take information from the internet, you can also instruct that same over here. Then you can make it, you can select a category to that. Then you have the conversation starter, meaning that anytime you go to that assistant, a question will be popped up automatically. You can select that, you can start the conversation. Then we have different models, and based on your need, you can select the response type, what kind of response the assistant should make, whether it will be code related, whether it should be knowledge related, and these are the file type that you can upload for that assistant, meaning that if you are looking for a particular disease and there are 10 to 11 books out there in the market related to that one disease, you can upload all of them in this assistant, and you don't have to read them. You can ask specific question that will be present in the book, and it will find it for you. It And then based on the question that you ask, whatever information is there written in the books, it will compile all of them and give you the summary of that, meaning that you don't have to read the entire thing from the scratch. You can get the latest summary of the book from this assistant. And if I'm going to talk about the HIPAA compliancy, as this product is set up in our server, any conversation that you do remains in our server, which is encrypted and not accessible to any user, meaning that it contains the HIPAA compliancy, as well as we are using the ChatGPT model API version, which also enables the HIPAA compliancy. HIPAA, if you inform HIPAA, HIPAA will allow that. Also, while uh, configuring, you can select to be HIPAA compliant. So that will enable the HIPAA compliancy and keep the data private to your server, and will help the user to not get breached. And the vulnerability that we have said, that can be covered using this configuration. So hope that answers the question, Vishu, of the HIPAA compliancy.
Yes, thank you for explaining this in detail. So, Onim, can our users deploy this service on their server?
Yes, it can be deployed in their server. So recently we have made this product in public, and it is a public repository that we have. So anyone who is interested, they can use this software and can deploy it on their server, meaning that the entire control will be in the user hand who is uh, actually buying this or utilizing this on their server. So whatever configuration that you need to do, whatever security you need to apply, you can apply those all, and all the data will be saved into your server. Even we as a product owner won't have the access to review or view any kind of data to that.